Hello, my name is Aiden Elam. We're going to talk about celiac disease today and how we prescribe people with celiac disease with exercise. So let's get right into it. First, we're going to really want to look at what celiac disease is. Most people really do have an okay understanding of it now, as 1% of the population does have celiac disease. It is an autoimmune disease that causes inflammatory responses in our gastrointestinal tract when gluten is present. We can get a little bit further into it with histology of it. So gluten gives off proteins that are called prolamins, and these prolamins are going to react with people with celiac disease, specifically in their small intestine, and it's going to be tried to be consumed. And when that happens, as you can see here, gluten is consumed into the small intestine, and it immediately creates a response. And that's a lymphocyte creating a T cell which is going to activate and go and attack the SI directly, specifically the villi of the small intestine. As you can see here, they are not present. As you can see out here, they have been they've been shortened and diminished. So you can assume that the damage is the villi long term. And the reason that this is a problem is because the villi is kind of pivotal to our nutrition consumption with all the foods we eat every day. So we've got lymphocytes of normal villi, we have villi of people without celiac, we have villi with those with celiacs, and we have villi with celiacs and those who are still consuming gluten. Now we have lymphocytes in these villi, not as many in the normal villi, typically because these lymphocytes aren't looking to attack gluten, but plenty in the celiac villi of both kinds, mainly because those are looking for gluten to attack. That being said, we have a different shape as well of these villi. In the normal villi and the villi that is celiac but gluten-free, we have a projection that's nice and long. We have a lot of area surrounding it. We can call this a large surface area for short, and that area is going to be where they consume nutrients. And what happens with those with celiac and consuming gluten is those villi are going to be attacked, damaged, taken down, and you're going to see a flattening in the SI, just like this. And you can see straightened crypts occur as well. Basically, that is wasted surface area, for that is not going to be able to pull in nutrients just like out here could. And that's not good. We need consumption of nutrients. And how do we contract this disease? So the way that we get this is not really contracted, but it's more inherited. So those who are unfortunate enough to get the genes for this from your parents, you may develop this the first time that you ingest gluten, and that can happen at any time, really. Does not matter on age. Doesn't matter on gender either. Both men and women can get this condition. But right now, we have more women today who do have celiac disease. And then how can celiac disease progress? So basically, celiac disease progresses less based on age, but more based on time, and that is time spent consuming gluten. With more gluten consumption, you're going to see a lot more damage to your villi, and more damage to your villi, you're going to not be able to consume as much nutrients, and you're going to see further implications to that as well a little later. And that is, it's more consumption of gluten for celiacs is the more damage. And then you got the symptoms of the celiac disease. When you consume gluten, you're going to have gastrointestinal inflammation, you're going to have diarrhea, you're going to have abdominal discomfort. You can even see some rashes show up on your skin. And then you have malnutrition, and that kind of comes in with more of that progressed celiac disease, if you will, because you have more damaged villi. That means you're not going to be able to consume as much nutrients. And that can be a little bit detrimental to those who might be able to form osteoporosis, so older people, specifically women, maybe postmenopausal. You're going to see it's going to be an issue for pregnancies. If you do have malnutrition due to celiac disease, because it is hard enough for one person to have nutrients for themselves with malnutrition that is also with another person. And this also may increase the chances of certain cancers in our gastrointestinal tract if we keep consuming gluten under celiac disease. So how do we diagnose this? Basically, we take blood tests, or we can take biopsies of people with celiac disease. Specifically, I would say traditionally we got a blood test looking for antibodies for gluten, for that like to attack glutinous properties. And once we find that that might be positive, that's when people get turned to get typically a colonoscopy. It might be an endoscopy as well as an option, but traditionally I believe it's colonoscopy for them to get a biopsy of their SI. And if that biopsy tends to look as if it has celiac disease written all over it, then that is where you're diagnosed. And the pivotal part of the diagnosis process is sometimes it takes years for people to be diagnosed with it. Not necessarily with the amount of time it takes for the blood tests or the colonoscopy to happen, but more so trying to figure out that that's the route that they needed to look for. On average, you see about 10 years for somebody to get diagnosed with celiac disease, which you can imagine can cause a lot of damage over time if we're still consuming gluten. Now, does this have an effect on exercise? Of course it can. Malnutrition can happen because of celiac disease, as we just talked about, and malnutrition is not exactly something that you want to have with somebody who is about to become active. You're going to find that those people might have a little bit more risk to injury, maybe due to lack of bone density, maybe due to the lack of iron. They might pass out. But we also see that every day we could have an accidental consumption of gluten, which makes somebody feel a little cruddy, and probably it wouldn't be a smart idea to exercise under those conditions either. That's how that can affect you daily when it comes to exercise. But how do we manage celiac disease? There really is one answer to that, and that's gluten-free diet, as you can see right here. You don't want these, you don't want these, none of that. Gluten-free diet has been underlined the way to manage this, as this is a lifelong disease. There is no cure for this disease yet. There are a lot of studies going on to try to find medicine for this, to try to find cures for this. But as it is today, the best cure is to not consume gluten. And then also we can look at getting blood tests for those who might feel as if they struggle with nutrition because of their celiac disease. It's a good idea to kind of get a range or a gauge of just how well they're doing with nutrients, and if they need to somehow consume more, especially with exercise. So today we're going to look at a case study of somebody with celiac disease. Max is a 23-year-old male who has just started a new job right out of college at a finance company where he finds himself sitting a lot. All of his vitals are healthy. He's a healthy man, but he has not had exercise experience really, at least not for a couple of years in this case. The reason we're looking at a client like this is because we really want to see specifically what celiac alone can really change. So obviously we want to take our pre-exercise conversation seriously. We want to talk to him, make sure he has no conditions about cardiovascular, metabolic, or renal disease, or symptoms of any of those, of course. We want to talk about the goals that he has in mind. And in this case, he has a goal of just maintaining his overall health, considering he is pretty healthy now. Maybe gain a little muscle along the way, maybe get a little bit more aerobically active, but really no weight change in his ideals here. And then obviously we have to ask for consent before we instruct exercise to Max, which he does give us permission to do. All right, so the exercise testing is as follows. The reason I went with these are because they're pretty easy to do, and then also he is not experienced with exercise as of late. So I feel as if a 12-minute walk slash run test is a nice test for him to have because he can go at his own pace, and it can give us a good VO2 max prediction. And we're going to assume that he has a good VO2 max. His push-up test is going to test his resistance. It's going to see how his upper body strength is, and he's going to test well in that. There's other things that you can do for resistance, like core, legs, to also test, but for now, this is what we have. And then the goniometer test is what we're going to be doing for the flexibility. This is sort of more important in my eyes for somebody who's going to be sedentary for his job at long hours of the day. We want to make sure that all of his range of motion is good at all times and that it's not lessening while he is being sedentary. But at the moment, his range of motion looks pretty great. So here's the exercise prescriptions. We have aerobic, resistance, and flexibility. For aerobic exercise, we're going to go 3 to 5 days a week, maintaining a 40% to 65% heart rate reserve. And that's mainly because he is starting out exercise. This is sort of on the lower end, the light intensity to moderate intensity. We can definitely increase that over time as he progresses. And we're going to do that for 45 minutes to 60 minutes per session, and he can do that however he'd like, whether it's walking, jogging, biking, swimming, sport involvement, anything, as long as it gets that heart moving. So resistance, we're going to go for 2 to 3 days a week. 65% of the 1 rep max is a good place to stay for about 10 to 12 repetitions. We're going to do that for 2 to 3 sets. For every exercise that we do. And we do really want to get one exercise on a major muscle group at least once per week. And we're going to do that through, to start, preferably body weightlifting and machine lifting, because those are some good beginners exercises where there is a little bit less injury risk as you get more experience. Then we can get into more free weightlifting, maybe some plyometric workouts, etc. And then flexibility, like I said, this is really important. 5 to 7 days. I would prefer 7 days. Stretching every day is a great idea. And then stretching until tight or slight discomfort is the way that we got our best stretch. Holding that for 20 to 30 seconds would be ideal. Trying to do a stretch for all major joints, all muscles. And he can do that any way he would like. Yoga, dynamic stretches, ballistic stretching, PNF stretching, they're all great. Dynamic and yoga are some pretty good beginners stretches. And then maybe some static stretching to finish the stretching. So what we really see from the exercise prescription is not a lot of change in what we do when we prescribe a normal person or somebody without celiac disease. And that's mainly because there isn't much that you have to change. It's more so of having precautions and having maybe modifications for those with the symptoms of celiac disease if they're flaring up at the time. So make sure that the client is not in abdominal pain or experiencing anything that has to do with having consumed gluten. If they are, it would be a smarter idea to maybe cancel on that day, because nobody really wants to exercise in pain, nor will they give their best exercise effort while they're in pain. Talk about the importance of being well nourished before workout or in general with your patient. It's very smart to do so, especially if you are prone to deficiencies. It can prevent passing out. That's always good. Focus on bone strengthening exercises for older adults with celiac disease in case they might be more prone to osteoporosis, as we talked earlier. And then also pull back / terminate workouts if we're feeling fatigued a little early or don't feel right. That just goes for mainly any conditions, usually. And then the conclusion is that, I mean, there isn't much to change with celiac disease except for those things that we just went over. Some points that I would say are are sort of good to have in mind with working with someone with celiac disease is to talk to them about how their disease affects them personally. Talk to them about deficiencies, and if you see that they do have a deficiency or poor nutrition, just be ready for possible days where they might feel a little bit more fatigue on exercises, and definitely be ready for possible fainting if there is a bad nutritional issue. But if we can try to not exercise when we're feeling that ahead of time, that would be ideal. Do not proceed with exercise while they're having gluten consumption symptoms as well. That's not a good idea. But as of that, everything else seems to be mainly the same as somebody who does not have this condition. And that being said, these are my references for what I just went over with all of you. And I hope you learned a little something about exercise and celiac disease.